Thank you so much once again for joining us. We are very glad to have you back. Please, if you are here to see our video where we have the first part of this antenatal care, kindly check our video catalog and check them up so that you'll be able to flow very well with us. And also, please don't forget to always share our video. We are available on YouTube, on Facebook, on TikTok, as well as WhatsApp. Follow us on all these social media platforms, and don't forget, subscribe to our YouTube channel. Thank you. Today we want to talk about the complications of pregnancy, in which antenatal care visit can help us in preventing them or in treating this condition if they already exist. So the first thing we'll be mentioning is eclampsia or pre-eclampsia. We are going to have a video on this where we'll be explaining in detail what pre-eclampsia and eclampsia are, other hypertension, and the rest of gestational diseases. But in a short form, preeclampsia is hypertension in pregnancy in a woman who has always been normotensive before, who doesn't have hypertension before the pregnancy. But during the pregnancy, she develops hypertension, and also not only hypertension, there will be proteinuria, meaning that there will be protein in her urine sample. But eclampsia is a complication of preeclampsia. So for a woman to have eclampsia, she will be having preeclampsia, and if not well treated or not treated at all, then she will continue to progress into eclampsia by developing fits, or what we call seizure. So meaning that preeclampsia is hypertension with proteinuria, while eclampsia is hypertension, proteinuria, and presence of fits, which we call seizure. So this is one of the complications of pregnancy, in which if a woman do not attend antenatal care, she's at risk of developing. However, any woman who attends antenatal care after taking some assessments on her, this will be discovered early and will be treated accordingly. The second complication, which is a kind of underlying disease, is HIV. So whenever a woman has HIV and she attends antenatal care, she will be taken care of very well, and we will try as much as possible to ensure that she does not have the mother-to-child transmission, which is one of the complications of HIV in pregnancy. For a woman who is HIV positive, it is important to do everything to prevent her from transmitting this virus to her child. This usually occurs in most cases during delivery. And for a woman who attends her antenatal care visit regularly, once it is discovered that she is HIV positive, she will be treated for this HIV so that her viral load count could be lowered to reduce the risk of transmitting this disease to her child. The third component of complications of pregnancy, which could be discovered or treated or prevented by antenatal care visit, is CNS malformation of the child. So in this case, some children, they develop hydrocephalus. Some of them, they have spider bifida. Some of them, they have meningocele or myelomeningocele. All these things could be prevented if a pregnant woman takes folic acid every day during her pregnancy. The next one is placenta previa. When we say placenta previa, we mean the attachment of placenta does not occur in the normal uterine wall where it's usually attached. But in this case, it attaches on the opening of the internal os of the cervix. This usually prevents the normal spontaneous vaginal delivery. Of course, placenta previa has grades. There is grade 1, 2, 3, and 4. So depending on the grade, usually 3 and 4, they normally prevent the spontaneous vaginal delivery. So in case of regular antenatal care visit by a pregnant woman, if this is diagnosed, then another route of delivery, usually the cesarean section, will be planned for the woman. In a nutshell, this is going to help in preventing prolonged labor during delivery, which usually leads to several complications. So regular antenatal visit will help in discovering this and planning how to treat the condition. The next one is ectopic pregnancy. In case of ectopic pregnancy, attending antenatal care visits regularly will help the woman to get diagnosed of this by the attending physician, and subsequent management procedures will be planned and scheduled for her. The last part that we'll be talking about in this video is taking some treatment that are important for every pregnant woman, which are usually done during the antenatal visit. The first which I'll be mentioning is what I already explained: use of folic acid regularly by pregnant women. This will be initiated and encouraged whenever she visits her antenatal care. Important in preventing her baby from having CNS malformations, which I have mentioned already, such as hydrocephalus, spina bifida, meningocele, myelomeningocele. The next thing is hematinics. During antenatal care visits, the woman will be given hematinics, which will help her in making sure she have adequate blood supply. And in adverse case, if she's anemic, she will need blood transfusion, which may be giving some transfusion reactions, which are also some other problems. So to prevent this, she will be given hematinics, which will help in maintaining her blood volume throughout the pregnancy, ensuring that she doesn't develop anemia. The next thing we'll be talking about is tetanus toxoid. Tetanus is present in most places, especially where there is dust and sand, and it is important that every pregnant woman is immunized against this virus. A pregnant woman who attends antenatal care visit regularly will be given tetanus toxoid vaccine. So this is given in 5 doses for every pregnant woman. But of course, if a woman completes her dose during her first pregnancy, then she will only be given booster doses during her subsequent pregnancy. This is very important to ensure that the woman does not transmit this tetanus virus into her child. The next thing is Rogam injection, which is for rhesus isoimmunization. This is in case of women who are rhesus negative and their husband are rhesus positive. So it is important that during the antenatal visit, they give them this vaccine, which will protect them against this rhesus isoimmunization. For every woman who is HIV positive, she will be placed on certain antiretroviral drugs, which will help in lowering her viral load count and ensuring that she does not transmit this virus to her child. All these are important to ensure that there is no intrauterine fetal death, and to ensure that there is no intrauterine growth restriction, and also to ensure that after delivery, even the baby doesn't come as stillbirth. This is very important in ensuring the overall health of both the mother, the baby, and the entire society. If you have learned one or two things from this video, kindly drop a comment for us in the comment section, and please don't forget to share this video to everyone. If you are here to subscribe to our channel, this is the right time to do that. Kindly subscribe to our channel. Don't forget to follow us on all our social media platforms, on TikTok, on Facebook, as well as WhatsApp. Until when next I come back onto your screen, thank you so much for joining. Bye for now.